Welcome back. This is Dr. Jin Sung, where clinical excellence meets excellent results. Today we're going to talk about stress. Stress is everywhere in our lives. How do we manage it so it does not cause chronic health conditions, right? Conditions like hypertension, diabetes, sleep disturbances, right? Things that can be managed. How can we do it, right? Number one, you have to be able to resolve or eliminate the stressors, right? I don't know how to tell you how to do that because everyone's stress is different and everyone manages it differently. However, you need to identify your stress points and go ahead and try to resolve those stress points as well as eliminate them if possible, right? So number one is very difficult and it's individualized, and you may need some help doing that. However, you can go ahead and try to improve your tolerance to stress. One way you can do that is exercise. Improving your tolerance means that your cup is not as full as it used to be, right? So you have more room to take on additional stress when needed. The way you create more room is to exercise. Exercise, one, increases oxygenation to the brain. Two, it releases good hormones, endorphins and enkephalins, right? So there's many benefits of exercise. So it can start with simply walking 15 to 20 minutes a day, right? And progress into walking and jogging, like intermittent. And then get yourself to the point where you can possibly do what we call burst exercises or HIIT exercises, right? High intensity interval training. So exercise would be a fantastic way. Another one is taking magnesium. Magnesium will, one, help relax your muscles, but two, calms your nervous system. Taking magnesium at night is a good way to absorb magnesium to get better sleep. And there are different forms of magnesium. I typically use 3 different forms in my office, right? We have magnesium glycinate, which we use for general magnesium support. When we have patients who have constipation on top of it, we use magnesium citrate. And the people who need more brain support with magnesium will use Magnesium L-threonate, okay? So magnesium is an important nutrient for that. Another one you can do is something called adaptogens. So when you have a stress response, you have cortisol issues where cortisol will spike and come down, starts to impact the brain. And cortisol can be managed better if you use some adaptogenic herbs, things like redalia, panax, ginseng. And using a combination of adaptogens can be more beneficial than just using one form of an adaptogen. So a combination of adaptogens can be quite beneficial. The next one is breathing, where we are under stress. We tend to be shallow breathers, right? We don't breathe deeply and relaxed. So I would suggest purchasing what we call a pulse oximeter. A pulse oximeter, now this is like a hospital grade version of a pulse oximeter, but you can buy one that's literally this big, right? Go to Amazon, you can purchase one for like $30. And you basically put it on your finger, okay? And the pulse oximeter will do 2 things. It'll give you your oxygen level, and then it'll give you a pulse rate. So with those 2 numbers, you can do kind of a biofeedback for yourself with breathing. So we want optimal numbers for your pulse rate and oxygen. Optimal numbers for oxygen is 98 to 100, okay? And then pulse can vary from patient to patient, but an ideal target to go is below 80, and ideally below 70, maybe 65 to 70, right, if you're athletic and so forth. So what you do is you take your pulse rate and your oxygen level, and then start doing breathing exercises. The one I like to do is called belly breathing, right? So what you do is you take a deep breath in, pushing your diaphragm down and sticking your belly out. Not taking deep breaths where you're going and using your shoulders. What you want to do is breathe deep, but pushing diaphragm down and belly out, right? And what you do is you take a breath in that may take 3 seconds, and then breathe out for 6 seconds. And then you repeat that movement until your oxygen level comes up to at least 98. And your pulse rate starts to drop and levels off. So that's one way of maintaining oxygen level, but it also helps your brain function, and it also helps relieve stress. So getting a pulse oximeter and getting some target numbers for yourself, or baseline numbers, and then trying to get those numbers to improve with belly breathing. The belly breathing can take you 5 minutes, you can do 10 minutes, or you can do 3 minutes. But the idea is to monitor yourself to get you to a target number, right? And that's very important because that target number will let you know that your body is starting to calm down. So these are just some basic things you can do on your own, and it can be quite beneficial in reducing stress or relieving stress for a lot of patients, okay? My name is Dr. Jin Sung, where clinical excellence meets excellent results, and we'll see you guys next week on the healthy side. Have an awesome day.